Hello guys, welcome to Pageant Imaging Hub. In today, radiographers and other health professionals education series. We look at diagnosis of pneumoperitoneum in chest X-ray, other considerations. Please don't forget to like, share, and subscribe to this channel so that you'll be notified when new video is released. Welcome back. What is pneumoperitoneum? Pneumoperitoneum is the presence of air or gas in the abdominal or peritoneal cavity. When we have free air that is not supposed to be where they are in the abdomen, then we will say it is a pneumoperitoneum. Of course, you know the some of the organs are hollow and contain air in them, like the intestine, the stomach, the duodenum. They have air in them. There are other hollow structures in the body that may contain some amount of air, and when there are perforation of these hollow structures, there is emission of air into the abdominal space, and that is what we call a pneumoperitoneum. There are other causes apart from this perforation of organs that contain air that can cause the emission of air or the presence of air in the abdomen, which we're going to look at shortly. Now, this air can be detected with chest X-ray. In fact, as low as 10 ml of free air can be seen in chest X-ray. Then, for lower volumes of air, CT is more sensitive in picking those volumes to be visible for a diagnosis to be made. Patient suspected of pneumoperitoneum should be left in erect or upright position for about 10 minutes before X-ray exposure is taken to ensure enough time for the air to rise to the highest point. So this point is important for the radiographers. Before you take X-ray of such a patient, it's always good to give some time, especially if the patient is lying down when he was brought into the X-ray room. Then what are the causes of pneumoperitoneum? We have perforated peptic ulcer. We have a perforated appendix, bowel, or bowel diverticulum. Once they are perforated, there will be emission of air or release of air into the abdomen. Then trauma. There could be trauma to the abdominal organs, blunt trauma that can cause lacerations. They can cause release of air from those hollow structures. Then post-surgery, during surgical interventions, there are found to be some air in the abdomen after the surgery. For at times, for a period of approximately 3 weeks, you may see some traces of air in some patient. Then subphrenic abscess. When there's subphrenic abscess, that is abscess below the diaphragm. If the abscess contains some microbes that produces air, that releases gas, then there could be air seen below the diaphragm. So these are the causes of pneumoperitoneum, and these give us an idea of these considerations we need to pay attention and not just rushing to say is a perforation when we see pneumoperitoneum in a chest X-ray. Then also let's look at pneumoperitoneum versus fundal gas. How to come out of the problem, because most cases the fundal gas may be mistaken as perforation or pneumoperitoneum, especially in some abdominally done chest X-ray, maybe due to patient position and all that. So, but there are some indication, there are some features we can use to differentiate fundal gas from pneumoperitoneum. We'll look at the thickness of the diaphragm. Is it that thick If it is thick, then it's probably um, fungal gas. But if it's thin, then it's expected that the air is just showing only the thickness of the diaphragm and not with the thickness of the stomach added to the thickness of the diaphragm, because the fungal gas will show a thickness of the stomach with the thickness of the diaphragm. Then we'll look at the length of the air bubble. Then, of course, if it is a pneumoperitoneum, then the course, the length will be longer than that of the fundal gas. Fundal gas is found in an organ which is localized in a particular location, and it's still the highest point of the the stomach, which is the fundus, that will commonly find this air. So it cannot trace and covers the whole length of the hemidiaphragm, but pneumoperitoneum can cover the length of the hemidiaphragm of the side concerned. So that can help us to differentiate between fundal gas and pneumoperitoneum. Then also we'll look at, are they bilaterally located or just one side? If the right side have a pneumoperitoneum, then if you are confused about the left, then we can assume that there is pneumoperitoneum. And if you're still more confused about whether the quantity or something like that, well, we can change the position of the patient. We can do lateral decubitus, left lateral decubitus, so that the air can rise to the right side. Then we can equally do a dorsal decubitus. The air will still rise. So this can help us to differentiate between fundal gas and pneumoperitoneum. So let's look at some images and see how these things appear in real actual sense. We'll just look at the theoretical basis. This is chest X-ray. We can see this is pneumoperitoneum, the dark crescent shaped structure there. Then this is another pneumoperitoneum, free air here. But if you look closely on this side, you will see a line up. That is the diaphragm, the left diaphragm, the wall. Then you see another one here. That is that of the stomach. This one is air fluid level in the fundus of the stomach. So you can see, if you look closely, you'll be able to appreciate these walls that the air have separated. You see how thin this is. The wall of the diaphragm. See how thin it is. Look at the next image. Look at the next image. This is also a case of pneumoperitoneum. You see the air. You see you see the air there. You also see another one here. In this case, we cannot appreciate the air in the stomach. Then you see another one. The volume is much. The volume of air is much. So you see pneumoperitoneum here. You see another one here. So these cases of pneumoperitoneum. Thank you for listening. Please like, share, and subscribe to this channel. Bye. Till next week.